Everyone is talking about their denial rates right now. A lot of people are saying that insurers are using AI to deny claims. Why aren't providers using AI to get ahead of those denials?
Hello, and welcome to Healthcare Strategies. I'm Anuja Vaidya, Senior Editor and Special Events Lead at Xcelligent Healthcare and Lead Writer on Virtual Healthcare. AI is being rapidly integrated into various types of health IT, promising faster and more accurate healthcare processes. This promise is especially exciting in healthcare revenue cycle management, which often suffers from delays and billing complexities. Today, Jacqueline Lapointe, Executive Editor and Lead Editor for Rev Cycle Management, is here with us to discuss all things AI in healthcare RCM. We will discuss how AI is advancing healthcare RCM, as well as some of the hurdles and key considerations of using this technology. Jacqueline, thank you for speaking with Healthcare Strategies today.
Thanks, Anusha, for having me on.
I'm so excited to discuss this topic with you because rev cycle management is one of those areas where we really have seen rapid AI deployment. So I thought, just to level set, maybe you could tell us about some of the more popular use cases for AI within the healthcare RCM world. Are there any specific processes that have really seen dramatic improvements with the addition of AI?
Yeah, and just to step back for a second, just 'cause I think it's really important to note that revenue cycle management probably represents one of the most compelling applications of artificial intelligence in healthcare, and that's for several reasons. First, like you mentioned, revenue cycle management is full of data-intensive processes, and these processes involve massive volumes of data. So we're talking patient data, claims data, reimbursement data, denials data. We're talking large amounts of structured information, which is what AI excels at processing and analyzing large data sets of structured data. And that's being used to identify patterns. Healthcare organizations are generating literally thousands upon thousands of claims daily, creating kind of ideal conditions for machine learning. And I think second, too, is that RCM is a series of repetitive rules-based tasks. Everything from registration all the way to claim submission to denials management. A lot of these functions follow very predictable patterns and they abide by very established rules. Talking about requirements in payer contracts, it pretty clearly defines what will get paid and what won't. There's a lot of gray here, I think, but in terms of a contract, it's saying these are the conditions under which we'll pay for services. And then tasks like coding verification, eligibility checks, claim processing, these are all highly standardized for the most part. And that's a real opportunity for AI to automate those repetitive processes. And then when you talk about repetitive manual processes, it's worth mentioning human error. With so many repetitive rules-based tasks, there's so many manual touch points. And where there are touch points, there's a lot of opportunity for human error to occur. So we see this a lot with denials. Common reasons for denials are incomplete or inaccurate patient information, missing data, and duplicate claims submissions. There's really an opportunity for AI to really streamline how the revenue cycle operates. In terms of established use cases, I think where we're seeing this a lot with AI in revenue cycle management, things like eligibility and benefits verification. I think that's kind of like one of the low-hanging fruits that we're seeing AI automating. Because again, it's very rules-based, and you're talking about people having to check in with payers. Will you cover this service? Is this person covered by insurance? What insurance do they have? Where are they at with their deductible and things like that? It's a lot of checking in to verify information. And this is where AI can really automate the process,
Yeah.
make it more efficient, and deliver quicker results. So not only does that benefit the provider, and that's start of the revenue cycle, making sure, like I said, you're getting accurate information, so you're preventing that common claim denial reason, but you're also making it quicker for the patient to understand what's going on. Healthcare experience is important, that clinical experience is important, but financial experience is wrapped up in that patient experience. So whenever you can get them that information up front and as accurate and quickly as possible, that's going to smooth out the entire experience all through billing. Yeah, so eligibility and benefits verification, I say, is one of the most widely implemented AI applications in revenue cycle management. We're also seeing AI really transforming medical coding and documentation. So again, taking a lot of data and kind of making sense of it. And we're talking about translating a lot of data. So medical coding is extremely complex, and you need to make sure you're capturing all of the codes possible within a clinical encounter. Incredibly difficult to chart, incredibly difficult for then a revenue cycle person to come in and look through charts and make sure everything was coded correctly. It's a lot of collaboration between clinical and administrative people. It goes through a lot. So AI is kind of able to go through and parse through clinical documentation, check to make sure stuff is accurate, check to make sure everything is complete, identify any possible gaps. That's where we're seeing AI. And I think something we'll talk about later is the idea of using generative AI in this area to identify missing information or potential mistakes that can prevent claim denials, prevent that revenue leakage. And on a similar note, another common use case, claims processing and denials management. I think for a long time, healthcare providers have been leveraging predictive analytics to identify patterns in claim denials to get ahead of them. But AI is really starting to switch it from being more of a reactive process to a proactive process where you're identifying problems before you submit the claim. AI is again able to parse through all of that data, all of those rules, and identify gaps, identify potential mistakes, and optimize claim submission before it even reaches the payer. Other common areas, I would say prior authorization, one of the biggest pain points in healthcare. Again, I think AI is really going to tackle those big administrative pain points first. That's where healthcare organizations are going to leverage AI to streamline their revenue cycles. Prior authorizations are constantly one of the most burdensome administrative tasks that providers have to accomplish. Not only that, but we know from AMA surveys that physicians also feel like they get in the way clinically, leading to adverse events for a lot of people. So tapping AI to streamline the authorization process by automating documentation collection, coordinating prior authorizations with healthcare payers. These are the things that AI can do to really cut the administrative burden and make the revenue cycle more efficient. And I think, again, just take some of that administrative burden off of revenue cycle teams to help tackle cases that may be of higher value, maybe a little more complex, and let AI handle some of the more routine, repetitive stuff.
Exactly. Kind of like that low hanging fruit burden, just really taking that off the teams, like you said. And I also think that it really sounds like AI is like touching every part of the revenue cycle, including that really kind of critical patient experience factor, because like you said, the financial experience is tied up in that patient experience. And it is also kind of the last touch point you often have with the hospital. So you may have had great care, but if you have a terrible billing and financial experience, it might leave a sour taste in the patient's mouth. So it really behooves health systems to streamline that stuff. And then again, the point you made too about just having this troves of claims data and being able to use technology to find those patterns more easily, find trend points more easily, and just ease the process for the health system and for the patients. Like with any sort of new technology, the promise is very exciting, and all these use cases really sound like they have the potential to really transform what is a very challenging area of the kind of healthcare continuum. But I'm curious, what are some of the barriers of integrating that AI into the RCM process? Are we seeing ethical considerations? Are we seeing data silos? What are some of those barriers that health systems are really looking to address to more effectively integrate AI?
Yeah, absolutely. So, despite a lot of advancement with adoption of AI and revenue cycle management, healthcare organizations still have to navigate a lot of key concerns and key considerations. I think first and foremost is a data privacy issue. I think we're seeing this anywhere you apply AI in healthcare, but particularly with financial AI systems in healthcare organizations, you have to maintain strict HIPAA compliance. That's the top of everyone's mind with any IT system, especially financial AI systems, because you're also going to be dealing with patient financial data. So not only are we talking about protected health information, personally identifiable information, but also that financial information, credit card info, bank data, depending on how people are paying. So you really have to make sure that whatever system you're investing in, they have their certifications. They're making data security a priority in terms of them developing their solutions. As we see too, there's a lot of third-party data breaches that happen. I think we'd be remiss to not talk about the Change Healthcare data breach, which was a major medical clearinghouse. A lot of information was compromised, and we're talking again patient health information, we're talking financial information. So, you're really worrying patients when you're like, you have all of my data, including potentially my life savings in my bank account. That's alarming. Yeah, so data security is definitely top of mind, even within the revenue cycle. And I think Anuja, you made a good point about the idea of data silos. Integration with legacy systems is always a concern as well. We're talking translating a lot of clinical data to the administrative side of the house. I think, fortunately, a lot of healthcare organizations utilize their EHR systems to do double duty. They provide revenue cycle management services, so that integration can be a lot easier. However, I think we see with revenue cycle management solutions is oftentimes a piecemeal strategy, a lot of different systems being used, so interoperability can be a challenge. And then for AI to really work, the tool needs access to robust data sets. So if you're thinking something like medical coding and documentation, That's highly tied to the clinical side of things. So being able to translate that data from a clinical system to a financial system, if you're using two different things, is going to be important and could be a major challenge depending on what your end to end revenue cycle management solution is. If you have an end to end revenue cycle management solution, that kind of thing. I think it's also important to note that human oversight is still required for most of these solutions. That's what I'm hearing from a lot of healthcare providers and a lot of revenue cycle management vendors. Keeping that human in the loop is still extremely important. So maybe it's not technically a concern or a challenge of adopting it, but I think it's still a consideration you want. I think a lot of people are still recommending keeping that human in the loop to handle a lot of the complexities of things like medical coding, clinical documentation, claim submission, denials management. There's a lot of opportunity to automate there, but I think you still need a person who's extremely knowledgeable about those things in order to yield the most favorable results to maximize the revenue owed to an organization, just because it is so complex. And then when you talk about something like the patient financial experience, you're also talking about something that requires a lot of sensitivity that an AI tool might not be able to deliver in certain cases, especially in cases that require financial assistance and a little more of that human touch to really handle appropriately.
Yeah, absolutely. It sounds like AI is not ready to fully take over, and maybe it should never fully take over. We still kind of need that, like you said, human element, human in the loop, human touch, especially when it comes to some of those sort of thorny or financial situations that you kind of want to handle more delicately.
And I think
Yeah.
too, like in healthcare in general, like you think of it, it's an extremely high touch point industry. You think about the clinical side, it's all about human contact for the most part. But I think what's unique about the revenue cycle is you are a little bit removed from that clinical experience. So applying AI can be a little bit easier in terms of making the business case. But I think it's also a great way for healthcare organizations to dip their toes in applying AI to their daily operations. It's
Hmm.
creating a very good operational case for healthcare organizations to be like, hey, this is working for our revenue cycle. We're encountering systems, solutions, vendors that do have strong data security. They're thinking about interoperability. They're thinking about human in the loop and stuff like that. And also applying AI to the revenue cycle management aspect of things, you face maybe a little bit less of a the regulatory compliance risk, and the adoption challenges maybe aren't as large as, say, a patient's lives or a patient's health.
Yeah.
Revenue and bottom line is still extremely important to keeping the doors open, keeping the lights on. But I think there's a lot you can overcome in terms of the challenges of adopting AI for revenue cycle management. And I think the rewards can be very significant for healthcare organizations.
Absolutely. Sounds like a good like entry point. And when I'm covering AI from the clinical side of things, I do hear a lot of clinical teams that may have concerns and things like that, and valid concerns, of course, because in that case, AI is literally making at times life or death decision support to clinicians or providing that decision support to clinicians. Whereas in this case, of course, as you said, financial experience is very important, but it's not quite the same thing as literally being involved in a patient's healthcare.
Mhm.
So I know we're coming up to the end of our time here, but I did want to really touch upon one last point, which is looking out ahead into sort of the future of AI in healthcare RCM. What are you seeing as some of the new capabilities that may emerge in the coming 3 to 5 years?
Yeah, AI adoption and revenue cycle management is very strong right now. There's still plenty of room for more adoption. I think of just of more of the standard AI technologies and predictive analytics and automation in general. There's recent survey data that show that nearly three quarters of healthcare organizations automate at least some parts of revenue cycle management, and about half of those organizations are using AI to automate it. So that's a recent survey from Acasa, and that's a revenue cycle management vendor. So I think because revenue cycle has so many different steps, there's still a lot more opportunity to plug into some of these existing capabilities. Maybe not the cutting edge stuff, but we're still talking like predictive analytics, room for opportunity to adopt and improve your revenue cycle, improve your bottom line. I think there's going to be a lot of new capabilities in the next 3 to 5 years as well in terms of generative AI and agentic AI. So the types of AI used for revenue cycle management is evolving. Top of mind is generative AI. So it's been a major buzzword for the last couple of years now, and we've seen it starting to influence revenue cycle management. And I think now it's arguably at the inflection point for adoption within this space. There's a recent stat that said 90% of revenue cycle leaders expect generative AI to play a bigger and beneficial role in medical coding operations. AI can craft some of these personalized appeals for denials management to try to recoup some of that money. It can craft personalized patient communications, financial counseling materials. Generative AI can be applied to systems to automatically update billing practices. So when your payer contracts change or evolve, when regulations shift, the inpatient prospective payment system, you see a rate change, outpatient prospective payment system, the Medicare physician fee schedule, those are constantly changing every year. So you need to stay abreast of those changes because they can really influence your bottom line. Maybe those systems can automatically update so the rules and regulations you have to follow in order to get paid. So generative AI is being used now. Vendors are definitely integrating it into their systems. And I think we'll see more of it now that some of those early adopters have come around and tested it out. So that's definitely, I think we'll see more of that in the next 3 to 5 years. I think we'll also see agentic AI being applied to revenue cycle management. That's another big buzzword, but we're seeing a lot of the major revenue cycle management vendors starting to say, hey, we're looking into how we can integrate this. I'm thinking R1 RCM recently had an announcement about an investment from an AI company that's saying, hey, we're going to look more into how agentic AI can be applied to revenue cycle management. We also heard from Ensemble Health Partners. They're taking a stab at how agentic AI can influence their end-to-end revenue cycle management solution. So it's definitely on the horizon. And just for people who may not know too much about it, agentic AI is a type of artificial intelligence that can act autonomously. So we're talking about an AI that can make decisions and be a little more proactive in the problem solving. So instead of providing responses to an input, this AI is getting ahead of that, can analyze situations, provide insights, make decisions for you. I can see how that can be applied to something like claims review to create a more autonomous claims review process, proactive denials management, automated appeals, financial counseling agents, because we're seeing these in the forms of virtual chatbots and stuff like that. So I think there's a lot of potential here for emerging AI capabilities to be applied to revenue cycle management. And I think there's an opportunity to create a more of an intelligent revenue cycle. And I think that's where healthcare organizations are going to go in the next couple of years because there's so much room to automate. There's so much room to apply technology to revenue cycle management and yield really significant results. And I'm talking like reducing costs, perhaps like 2 to 3%, which we know healthcare is like almost a $5 trillion industry. That's significant. Reducing costs, improving revenue. Denials are up. Everyone is talking about their denial rates right now. A lot of people are saying that insurers are using AI to deny claims. Why aren't providers using AI to get ahead of those denials? I think that's where the industry is heading, is towards that intelligent revenue cycle where technology can be applied to take the mundane, manual, and error-prone tasks, make them more efficient, freeing up revenue cycle staff to do the more complex cases that can yield perhaps significantly more revenue that's owed to the organization, rather than having your staff chasing after every little dollar that's being denied, rejected, that's tied up in patient collections or something. It's really freeing up your staff to do some of the more value-adding tasks and using technology to take over those repetitive processes.
Absolutely. Yeah, I think you hit the nail on the head when you said a more intelligent revenue cycle process. I think we can all get behind that. Health systems want that, patients want that. So here's hoping that AI can really push the industry towards that more intelligent RCM process. Thank you so much for coming on today, Jacqueline. It's been such a pleasure chatting with you.
Thank you so much for having me.
And thank you, listener, for tuning in. If you liked what you heard, head over to Spotify or Apple and drop us a review. We will be choosing some of our reviews to be read on the show in appreciation, so keep listening through to the end because you might get name dropped. See you next time. Music by Kyle Murphy and production by me, Kelsey Waddell.
This is an Informa Tech Target production.